Okay, here we're going to be talking about neoplasia. And neoplasia, from the name of it, actually means new cells. And neoplasia is all to do with cancer and carcinogenic carcinomas and sarcomas. And we're just going to be talking about it. And I think before we start discussing what malignant cells are and what benign, we actually need to understand what is it that makes cancer cancer. And previously we've talked about how it's mu, right? So monoclonal, irreversible, and unregulated. Those are the things that characterize cancer: monoclonality, irregularity, and irreversibility, and being unregulated. What is the difference between benign and malignant cells, or benign and malignant cancers? Well, firstly, what causes cancer? Malignant tumors are what cause cancer. Malignancy, the ability to move around the body, that's what's causing cancer. And essentially, increased mitotic rate specifically does not mean cancer. So having an increased mitotic rate will not equal to cancer. What is it that the key ability of malignant cells depend on their ability to metastasize. Metastasize, I should say. Okay? Now, the ability to metastasize can manifest in 3 ways. So essentially, there are these cells, and just having repeated cell division cycles again and again and again does not necessarily mean cancer, but often with increased replication, increased cell division, increased mutation, it can lead to cancer. But now we're going to focus on the ability to metastasize, and there's a couple of key concepts I want to discuss. But before any clinical symptoms are displayed, the malignant cells must double 30 times. This number you need to ingrain into your head. 30 doubling times, 30 repeats of the cells, 30 doubling times essentially, is before the tumor is going to display any clinical symptoms. What is a carcinoma and what is a sarcoma? Carcinoma and sarcoma are different. Carcinoma, however, they're both malignant. Carcinoma is malignancy of epithelial tissues, such as squamous cell, epithelium, transitional cell, glandular cell. Sarcoma is the malignancy of sarcoma, look at this middle letter, of connective tissue or mesenchymal tissue. So sarcomas are the malignancy of mesenchymal or connective tissue, and that's the difference, okay? But there's also a number of differences, but the key difference, the basis of it is that this is for epithelial tissue and this is for mesenchymal tissue, such as bone, connective tissue, things like that. The things that allow metastasis to occur. Metastasis occurs in 3 ways, via 3 mechanisms, which is hematogenous, seeding, and lymphatic. So, essentially, what can happen with the carcinoma is that there's a highway system for this to spread, for these kind of like terrorists to infiltrate, and they're double agents. So our macrophages don't always, our macrophages can't actually attack these sometimes, and that's why these are double agents, and there are highways in our bodies for these double agents, and the primary highway that they're going to use to infiltrate our body are the lymph nodes. So, the carcinoma, which was the malignancy of epithelial tissue, is going to infiltrate our body by going into the lymph vessels and the lymph nodes. And it's going to target the regional lymph nodes specifically, not necessarily, so if it's in the region of the axilla, it's going to go to the axillary lymph nodes or the breast axillary lymph nodes. So they're going to drain to the regional lymph nodes, specifically the subscapular sinus on the regional lymph nodes. From the lymph nodes, if they go into the efferent lymph vessels, they can then go into the thoracic duct and from there into the subclavian. Therefore, if if this carcinoma does drain into the lymph nodes, it can then go to the subclavian and enter our blood vessels, which would then make this hematogenous. I hope I'm saying that right. The key difference here is that the sarcoma, which was a malignancy of connective tissue or mesenchymal tissue, does not need to go to the lymph nodes. Our sarcoma can go straight into our blood vessels. So instead of going lymphatics, then hematogenous, like here in carcinoma loves going to the lymph nodes first. Sarcoma can just skip lymph node completely and go straight to hematogenous, which actually makes sarcoma possibly more dangerous, because if these carcinoma goes to the lymph node, sarcoma doesn't, carcinoma can be detected at this stage if it becomes palpable within the lymph nodes. Do you understand? Whereas here, if it goes straight to the blood vessels, it can spread faster, okay, and more silent, faster and silently. Okay. Seeding. What was the concept of seeding? Well, essentially, the concept of seeding is that cancers, basically, that are surface-derived cancers, that are on the surface of things, it's possible for them to be kind of like easily passed out, easy to throw out these implants, and for it to metastasize in the omentum. Seeding is specifically for cancers in cavities, so the cavities would be the pouch of Douglas in females or the prostate in males, okay? I'll do something else on that, but the most common aspects are hematogenous and lymphatic. Now, what about this diagram? Here we're talking about metastasis. Here you have the brain, you have the lung, you have the liver, and then you have the vertebral column as well as the prostate. Here, I want to ask you, if you're talking about most common cancers, here I've put the metastatic myth of most common cancers. And that's our jobs as clinicians is to ask, is metastasis more common than the primary cancers in that region? What does that mean? For example, if you have the lungs or if you have the liver, let's say if you have the lungs, the most common cancer within the lungs may not necessarily just be lung cancer. So it may not just be the primary cancer, aka the cancer that's localized within that organ. So I'll tell you what the answer is. The most common cancer here would be metastasis of breast cancer. Therefore, the most common cancer in the lung is actually breast cancer. Okay, do you understand that concept? So because certain cancers can metastasize so much, here my example is prostate, but breast cancer is the one that's high yield, because the breast cancer can then metastasize to bone. It can metastasize to lung, to liver. Okay, so therefore in the lung the most common cancer is actually metastasis from breast cancer. Okay, so therefore women are also more likely to get lung cancer. That's the reasoning behind that. In bone, the most common cancer is not something like myeloma or osteogenic sarcoma. It is in fact, once again, breast cancer. And that's because of something called the Batson system, which is some sort of venous complex that has a connection to the bone. And we'll discuss that in another video. Most common bone metastasis, most common bones that are bones that are metastasized to our number one vertebral column. Ingrain this in your head again. The most common bone that is metastasized to is the vertebral column. And the femoral head, the head of the femur. And breast cancer can also appear there. So sometimes if doctors find some sort of metastasis within the femoral head or some kind of, something abnormal, they're going to think it's degenerative arthritis. But in fact, it's actually breast cancer that has metastasized there. So you have to be aware of this. Degenerative arthritis. It's not that. All right. And here, the prostate can metastasize to bone, it can metastasize to liver, it can metastasize to lungs, it can metastasize to brain. So it's really a metastatic myth, okay? Metastasis can be of two types: lytic, which means when it's kind of breaking down the bone, and this can show up in scans as lucency, which is an absence of bone, or it can show up, or metastasis can be blastic, which is creation of bone, therefore in the scans it will show up like an entity. By the way, what is the most common organ? We talked about the most common bones where metastasis occurs to. The most common organ where metastasis occurs to are lymph nodes. Why? Because carcinoma must first become lymph nodes and then becomes hematogenous, and this makes sense because carcinoma is more common than sarcoma.